طالب أحمد أبو-شرق، طالب خالد الشرع، الأستاذ المشرف على البحث هو دكتور عماد فرجو. تفضل.
Thank you, Dr. Ahmed, for this nice presentation. Good morning, everyone. 10 دقائق راح أخذ منهم أكثر إن شاء الله. First, before starting, allow me to thank my faculty, represented by Dr. Bassam. Thank you for giving us the chance, students, to be participants in such an honorable event. Secondly and foremost, Dr. Imad, thank you for taking the time to teach us how to do research. Thank you very much. And finally, my colleague, just kidding, this was not actually the situation. Thank you very much. I learned a lot from you and with you. Starting my research, hypertension. Is it worthy really to research hypertension? The answer is definitely yes. Systemic hypertension is a major public health problem worldwide. How common is this condition? World Health Organization estimates for hypertension are, they say that up to 1 billion individuals worldwide are affected by hypertension. That is to say, 1 out of 14 individuals. This is very frightening. Some statistics, the United States, the data in the United States estimates that the prevalence of hypertension there is ranging between 29 to 31%. What about our country, a recently urbanized country? Do we have a higher or a lower prevalence of hypertension? A recent study done by some of the leading authors in our country, Hashim Jiddo et al. From the University of Just, estimated the prevalence of hypertension in our society at 32.3%, higher than the United States. So what? Hypertension is a common condition. Is there anything to fear? Yes. The complications, microvascular, I'm sure all of you are familiar with them, and the World Health Organization estimates that the suboptimal blood pressure values are responsible for at least 2/3 of ischemic of cerebrovascular diseases and approximately 1/2 of congestive heart failure. So common serious complications in our country. How does this translate? These are the mortality data in Jordan, 2009, the most recent one, Ministry of Health. Out of 100 Jordanians that died each year, 35 of them died due to cardiovascular disease. So, common serious complications, and as we can deduce easily, it is an important cause of death among our countrymen. Our objective, so we easily started this research, having the following aims. We wanted to know some epidemiological data about hypertensive patients who present with complications of their disease. Secondly, we looked for risk factors. Firstly, for cardiovascular diseases in general, and secondly, for poor control of blood pressure. The design of our study, a cross-sectional study design. The setting of our hospital, of our study, Karak Teaching Hospital, and due to incompleteness of data collection, we moved to Al-Bashir Hospital, and these are the approvals to the administrations of both hospitals. Thank you. طبعا دكتور بسام تتجننك في المواصفات. The duration of our study was 17 months from October 2011 till March 2013. The patient encounter, we met the patients after they were admitted into the hospital. The inclusion criteria was being a hypertensive patient, admitted for complication of hypertension, and finally being conscious and oriented in order to be able to take information from the patient himself. The study subjects, we were successful at collecting data from 182 subjects. 20% of our patients came from Karak Hospital, and 80% came from Al-Bashir. We had approximately equal numbers of males and females. The mean age of males was 67 years versus 64 years for females. The age groups of patients, most patients were in the older age group. 70% of them were 60 years of age or older. The sex distribution of age groups, males tended to present earlier with complications. 35% of them presented in the middle age group. Marital status, 80% were married. Educational level, it was a shock for me at the beginning. 86% were either illiterate or had a school level education. But monthly family income, 60% less than 250 JDs. Only 13% of patients reported an income more than 500 JDs. The occupation, most of males were either retired or manual workers, while most females were either housewives or farmers. Provisional diagnosis, we had 4 main provisional diagnoses. The most common was angina, acute coronary syndrome at 33%, followed by decompensated heart failure, 29%, CVA, transient ischemic attack, 27%, and finally uncontrolled hypertension, approximately 7%. And we looked at the provisional diagnosis based on the sex, 30 males and females. We discovered that males tended to present more with angina, acute coronary syndrome, while for females they tended more to present with CVA and transient ischemic attack. Based on the age groups, in the younger age group, most patients presented with angina, acute coronary syndrome, while in the older age group, they presented with CVA, transient ischemic attack. In the duration of hypertension, most of patients had a diagnosis of 10 years or more, approximately more than 50% of patients. The mean age since diagnosis was 10 years plus minus 7.5 years. In number of drugs, most of our patients were on monotherapy, 43%. Very few patients were on triple, quadruple, and pental therapy, if I can say. The antihypertensive drugs used have diuretics. The most commonly used are the least common at 13%. Now the risk factors, objectivity, amount of salt and fat in diet. I have to explain this. We did not use on a subjective way of assessing that. Therefore, we only depended on asking the patient, compared with your family members, your relatives, your neighbors, how much do you assess the amount of salt and fat do you take? About 50% of patients said that they had some form of restrictions on their salt. Concerning fat, 60% of them restricted their fat. How accurate are these reports? Is there a self-denial in this issue? I don't know, but I expect that. Cigarette smoking also was common, 44%. However, this percentage would raise if we excluded females. 63% of males smoke, while only 17% of females smoke. The number of cigarettes, most smoke less than 20 cigarettes per day, 20 or less cigarettes per day, 55% of patients. Diagnosis of hyperlipidemia, 56%. Diabetes, 52% of patients. No significant difference was found in the sex distribution of diabetes, neither of this family history, as I'll come later on. The family history of hypertension was present in 73% of patients. Again, no significant difference between the two sexes. Death due to cardiovascular disease, almost half of patients. Again, no significant difference. Conclusion, hypertension was more common in the older age group than the younger age group. Most of our patients were chronic hypertensive on drug treatment. More than 44% of them had a diagnosis, a duration of 10 years or more. The percentage of patients, most common males were either retired or manual workers, while most females were housewives and farmers. 86% of our patients were illiterate or had a school-level education. Dietary habits, 52% restricted salt, 64% restricted the fat. Smoking was 4 times more common among males than females. 44% overall of patients smoked. And finally, family history of hypertension due to cardiovascular disease was present in 73 and 48% of patients, respectively. Finally, of course, intuition, patients should restrict their salt fat intake, stop smoking. What is frightening in our study is that we discovered that more than 1/3 of patients did not pay attention to their salt, their fat intake, and smoke. I think that this shows us the importance of counseling, firm counseling to our patients on the importance of changing and sacrificing some of the dietary habits that they have, but surely this falls short of threatening them with death. Recommendations, 86% are illiterate or had a school-level education. Simply, this shows us that we have to take this into consideration when counseling our patients, and if we are to devise educational materials to such groups, this should be taken into consideration. Finally, most patients had a family history. 74% of them had a family history of hypertension in their first-degree relatives. So, of course, screening for first-degree relatives for this. And finally, this is a statement that I heard from one of our patients. It raises the question of another research that needs to be conducted other than answering these questions. What percentage of our patients do know about the complications of hypertension? If 86% of patients are illiterate or had a school level education? Do they know about the complications of hypertension? If they knew, do they know the target blood pressure levels? If they know the target blood pressure levels and know the complications, do they know how to reach these target blood pressure goals? And finally, and most importantly, if they knew the answer to all of these questions, would they care to sacrifice المنسف والدخان والى اخره عشان ينزل الضغط 140 على 90؟ Thank you for
One or two questions.